Visceral systemic therapy begins with understanding. In matters of health, awareness is essential, but how to act is always a personal choice. All diseases share common functional patterns. They arise from a disruption of bioenergetic balance and a weakening of the immune system. My role is not to treat the body, but to help people stop interfering with its natural ability to interact harmoniously with the environment. When people recover from their conditions, this is not my achievement. It is theirs. They learn how to help their own body stand back up, and the body always rises, even from states that seem almost lifeless. Age does not play a decisive role. Neither does the initial state of health. In practice, there have been multiple cases of obesity where patients lost an average of 7 to 10 kilograms per course, without the use of any medications. Daily urine output increased to as much as 4 liters. In one remarkable case, a patient lost 41 kilograms over 4 courses, primarily due to restored fluid elimination. Significant results were also observed in the treatment of gallstone disease. Ultrasound examinations confirmed the release of stones from the gallbladder and the cleansing and restoration of liver function. As a result, many patients avoided surgical removal of the gallbladder and retained the ability to live and work normally. In 3 cases, after the 3rd course, formations resembling a new organ, specifically kidney-like structures, were observed at the site of removed organs, confirmed by ultrasound studies. This allows us to state that the human body is a self-regulating, self-restoring, and self-reproducing biocybernetic system. All diseases share the same functional roots: disturbances in bioenergetic balance and suppression of immune function. By restoring these mechanisms, without medications, it becomes possible not only to eliminate disease, but also to prevent new ones from forming. Now, let us examine the most challenging clinical cases encountered in practice. Case 1. Patient S, 45 years old. She had suffered from psoriasis for 15 years. She had been treated by dermatologists without improvement, used hormonal ointments, and completed 14 treatment courses. After the very first course of visceral systemic therapy, she completely stopped using topical medications. The treatment did not involve direct action on the skin. Instead, it followed the systemic methodology described earlier. During a period of partial fasting, turpentine baths were used, as well as microenemas and other supportive cleansing procedures. As the liver, kidneys, and gallbladder were ocheexed of metabolic waste, the skin was ocheexed simultaneously. As internal organ function normalized, the skin gradually restored its natural appearance and healthy physiological functions. Case 2. Patient Y, 47 years old. She suffered from a systemic blood disorder, urolithiasis, and had previously undergone surgical removal of the uterus. At the time of her first visit, her skin had a dull, dirty bronze coloration. An ultrasound examination revealed a stone measuring 2 by 24 millimeters in the cavity of the left kidney. For 12 years, she had been taking hormonal medications. She completed 6 therapeutic courses and discontinued hormonal drugs after the very first course. After the second course, an acute exacerbation occurred, resembling renal colic. She experienced severe girdling pain in the lower back, more pronounced on the right side, radiating downward along the ureter. Her body temperature rose to 38 degrees Celsius. Her urine became dark, with a color resembling diluted blood, and contained a large amount of suspended matter. Soon afterward, a small stone, about the size of a match head, brick-colored, passed through the ureter. Following this, her condition improved, and the pain significantly subsided. During the third course, the remaining portion of the stone was expelled. At the same time, the liver, gallbladder, and pancreas were also cleansed. Current ultrasound examinations confirm the complete absence of stones in the cavity of the left kidney. Her skin continues to cleanse, brightens, and gradually returns to a healthy, natural appearance. Case 3. Patient L, 33 years old. She had suffered from rheumatoid arthritis for 5 years and was taking hormonal medications, 6 tablets of dexamethasone daily. She had been treated by a rheumatologist without noticeable improvement. Persistent contractures developed in the knee joints, the joints of the hands and feet, and in the sacral region. The joints were significantly enlarged, swollen, deformed, and extremely painful. There was a severe limitation of movement and pronounced morning stiffness. During the very first therapeutic course, she completely discontinued hormonal medications. The gallbladder was the first organ to cleanse properly and return to its normal anatomical boundaries. After that, the kidneys and the liver were cleansed. As a result, full motor function was restored. The joints regained their natural shape, blood test results normalized, and the patient returned to a normal, active life. Cases of multiple sclerosis. 2 female patients were observed with a diagnosis of multiple sclerosis. At the time of initial consultation, they presented with impaired coordination, an unsteady, staggering gait, and memory loss. Both women completed 3 therapeutic courses. After the third course, a stable sense of balance was achieved, and memory noticeably improved. Observations in patients after gallbladder removal. In patients who had previously undergone gallbladder removal, a significant release of bile was observed through both the intestines and the stomach. In some cases, vomiting persisted for 5 to 7 days. The color of the bile changed over time, from yellow-brown or greenish shades at the beginning to a bright yellow color after several cleansing procedures. In some cases, the volume of bile released reached 2 to 3 liters per course. This therapy is carried out without the use of expensive medications. It relies entirely on natural methods and products available at any time of the year. The use of partial fasting allows most patients to remain active and functional during the course. People are able to continue their daily work, even in situations that require high concentration and quick reactions, such as driving in heavy city traffic. Almost all patients who follow the method consistently and with discipline are able to avoid surgical interventions. This is especially true for conditions affecting the gallbladder and the spine. The social impact of this approach is significant. Many people return to an active, healthy life after years of physical limitation, chronic pain, and reduced mobility. A systemic approach creates a synergistic effect that appears regardless of diagnosis. The immune system becomes stronger, and the body's resistance to infections increases. The body undergoes a process of natural rejuvenation. The musculoskeletal system improves. Posture normalizes, and conditions such as scoliosis, kyphosis, and arthritis gradually recede. Spinal flexibility is restored. Salt deposits in ligaments and joints dissolve. As liver and kidney function recovers, vision and hearing often improve. Excess weight decreases, while insufficient weight normalizes. Tissue tone improves, leading to faster regeneration after injuries. Scar tissue softens and dissolves. Pigmentation spots, warts, and nodules disappear. The skin regains its natural color, moisture, and elasticity. After the very first course, breathing becomes deeper, and chest mobility increases. Physical and emotional endurance rise. Memory sharpens. Work capacity increases. Vital energy returns. Sensitivity to external stressors decreases. Obsessive thoughts, fears, and hysterical reactions gradually fade. For many patients, chronic constipation resolves, and natural daily bowel movements are restored. Today, more and more doctors recognize the value of both conventional and alternative approaches to health. They no longer force patients to choose only one path, but encourage them to use any methods that prove effective in their individual case. The Journal of the American Medical Association notes that alternative therapies, which are, in essence, medical interventions, but are not widely taught in medical schools and are rarely practiced in U.S. hospitals, are generating growing interest among the media, healthcare professionals, government institutions, and the public. Discussing recent trends, one medical journal observed that in the past, specialists in scientific medicine were skeptical of alternative methods. Today, however, medical schools across the United States, including Harvard, Stanford, the University of Arizona, and Yale, now offer additional courses in alternative medicine. The same journal reports how many patients seek to restore their health. Surveys conducted outside the United States show that alternative medicine is popular in all developed countries. Over a 12-month period, the percentage of people using alternative therapies reached 15% in Canada, 33% in Finland, and 49% in Australia. The journal emphasizes that the demand for alternative therapies is high, despite the fact that treatment costs are rarely covered by insurance. In conclusion, the article states that current demand does not fully reflect real need. If alternative treatments were covered by insurance, demand would be significantly higher. For those who are patient and willing to reflect, I will explain in simple terms what illness truly is and how the body can return to health. Without understanding these foundations, it is difficult to respond correctly to disease, whether it affects you or someone close to you. The human body is a flow-based system. Substances such as food, air, water, and medications enter the body, participate in biochemical processes, influence organs and tissues, undergo transformation, and are then eliminated. When substances incompatible with life-supporting organs enter the body, spoiled food, toxic compounds, infections, viruses, the body responds with protective reactions. Diarrhea, vomiting, pain, fever, skin eruptions. These are not failures, but defense mechanisms. Substances that disrupt the body's internal balance or cause harm are called homotoxins, human-made or environmental poisons. The body's struggle against these toxins manifests as processes, conditions, and symptoms that we commonly call disease. Illness is not the enemy. It is the language through which the body fights to restore balance. If illness is understood as the body's fight against homotoxins, or as the damage caused by them, then health is simply the absence of these toxins and the harm they create. Through illness, the body attempts to free itself from homotoxins and compensate for the damage they cause. The highest good for a human being is health, said the ancient Greeks, contemporaries of the physician Asclepius. There is no sharp boundary between health and disease. According to Galen, there are three states of the human body: health, when the body functions fully and harmoniously; disease, the opposite state; and a third condition, neither health nor disease. So where do all these illnesses come from? How can we truly understand their origin? This is one of the most fundamental questions of human existence, and we will attempt to answer it. Most patients are trapped in a medical belief that the cause of disease exists outside the body, that the human body is merely a victim of viruses or microbes. From this perspective, one can only ask in frustration, how did this happen? And why did it happen to me? Again and again, I patiently explain to such patients, your pain, suffering, and illness are the result of your own choices, your diet, your lifestyle, the medications you take, and, as a consequence, the accumulation of homotoxins in the body. These toxins are the real enemies and the true cause of disease. They must be removed if the body is to return to health. The liver and the kidneys are the body's main detox organs. The liver releases toxins through the intestines. The kidneys remove waste through urine. But when the liver is overloaded and the intestines are congested, toxins have nowhere to go, so they return into the bloodstream. The same happens when the kidneys are inflamed or blocked. Toxins circulate back into the blood, poisoning the entire system. This toxic blood creates chaos in the body, pain, inflammation, and chronic symptoms. Migraine is one of the most common signals, not caused by alcohol in a glass, but by toxic fermentation inside the gut. When detox organs fail, the body speaks through pain. Suppressing the signal only makes it worse. Nature has backup systems. The body begins to eliminate toxins through the skin, lungs, and mucous membranes. The lungs try to replace the kidneys, but lungs are not kidneys. That is how bronchitis, asthma, and chronic inflammation appear. The skin tries to replace the liver, and overloaded skin responds with irritation, rashes, and disease. These are not random illnesses. They are survival mechanisms. The natural function of the skin is to release gases, evaporate water, and remove small amounts of toxins through glands. But when toxins overload the body, the skin becomes a replacement exit. Toxic fats and waste are forced out through skin glands, overloading them. Their function weakens. Toxins stagnate inside the pores. Inflammation begins. This is how chronic skin diseases appear: eczema, psoriasis, ichthyosis. Skin conditions are not random. They are signals of toxic overload, and they can be reversed by restoring the liver, kidneys, and digestive system. When only surface layers are affected, the discharge is watery. When deeper layers are involved, mucus, pus, or blood appears. This same mechanism explains sinusitis, bronchitis, gastritis, arthritis, cysts, and tumors. Disease names describe where the body was forced to detox. Only after cells are damaged by toxins do microbes and parasites appear. In a clean body, there is no place for disease. When the main detox organs fail, endocrine glands join the fight: the pituitary, thyroid, and adrenal glands. When endocrine glands are forced to work under constant overload, they increase their secretion. To neutralize toxins, the body demands more hormones and regulatory signals. But gland secretion is designed for a normal metabolic load. When overload becomes chronic, the glands begin to enlarge, and prolonged overload often leads to destructive outcomes: endocrine tumors. Without removing toxins from the glands themselves and from the body layers they control, true healing becomes impossible. According to homotoxicologist Hans-Heinrich Reckeweg, disease is not an enemy. It is a biologically purposeful defense reaction against internal or external toxins. Disease is the body's attempt to neutralize toxic damage and preserve life for as long as possible. According to homotoxicologist Hans-Heinrich Reckeweg, disease is not a mistake. It is a biologically purposeful defense response against internal or external toxins. Disease is the body's attempt to neutralize toxic damage and preserve life for as long as possible. Disease, or homotoxicosis, is not a single event. It is a dynamic process that unfolds in stages. Reckeweg identified 6 phases of this process. The first 3 phases represent the body's ability to cope with toxins. Excretion. Toxins leave through sweat, urine, stool, saliva, lymph. Reaction. Fever, inflammation, pain, vomiting, diarrhea appear. Deposition. Toxins are isolated and stored in tissues. At these stages, the body still maintains balance and stays close to health. The last three phases begin when toxins cannot be neutralized. They may be too strong, too numerous, or constantly suppressed by drugs. Unneutralized toxins become retotoxins. Inappropriate use of medications, anti-inflammatory drugs, antibiotics, enzyme blockers can accelerate this progression. The impregnation phase begins when active toxins penetrate the space between cells and partially enter the cells themselves. This signals exhaustion of the body's defense system and the appearance of a weak link. At this stage, full recovery is still possible with timely and systemic healing. The degeneration phase marks the destruction of intracellular and even nuclear structures. At this level, the body's ability to regenerate is severely limited. Regression becomes extremely difficult. The neoplastic phase is the final stage. It is characterized by malignant transformations in tissues and organs. At this point, full recovery is no longer possible. Life can only be sustained through constant, precise, and lifelong support. The spread of homotoxicosis follows two possible paths. It can progress from one phase to a more severe one, or move from one tissue to another. This process is called vicarization. Progressive vicarization means worsening. Regressive vicarization means healing. When the body moves from heavier phases to lighter ones, its defense system is working. Health is achieved through a systemic, holistic approach that unites physical and inner factors. In our lives, we rely mostly on our own strength and on the support of others. We struggle, we try to be healthy and happy, but often it does not work. Because we forget one simple truth. Without inner support, human effort alone is not enough. Prayer is called the breath of the soul. As strong as prayer is, so alive is the soul. One fisherman once wrote, "Pray on one oar and work on the other." When he tried to row with only one oar, the boat just spun in circles. Only together do they move us forward. During illness, the greatest danger is not pain or weakness. It is fear, hopelessness, and loss of faith. People often die not from hunger or thirst, but from fear itself. Those who keep moving, even in despair, find a way out. Modern science confirms, treating the body alone is incomplete. Health is the unity of body, mind, and inner state. True healing begins when we restore balance on all levels. I wish everyone health and faith. The human body, from a systems perspective, is a complex and unified whole. Each organ performs its own function, yet all organs are deeply interconnected. When breathing, circulation, elimination, and metabolism work in balance, toxic byproducts pose no real danger. The body has enormous reserve power. Health returns when we remove everything that blocks these core functions. Systemic healing works by addressing the root, not isolated symptoms. The main task is simple: restore breathing, nutrition, elimination, and metabolic exchange. This approach includes practical methods: visceral organ massage, partial fasting with fruit and vegetable juices, microenemas, and hydrotherapy. Recovery happens through consistent, step-by-step courses. Illness is not only physical pain, but also hopelessness imposed by diagnosis. There are no local diseases. The whole person is always affected. Healing begins when we restore 4 core functions: breathing, circulation, elimination, and metabolism. Health must be earned through awareness, effort, and trust in the body's inner resources. In most patients, urine output was critically low, less than 1 liter per day. Everything the kidneys failed to remove remained in the blood, joints, muscles, and tissues. The task was clear: restore the kidney's ability to maintain fluid and mineral balance. Along with visceral massage, microenemas were used. This activated deep cleansing, the digestive tract, blood vessels, cell membranes, and intercellular fluid. As stagnation dissolved, natural strength returned. Urine output increased to 3 liters per day, metabolism improved, weight decreased, and the skin regained elasticity and healthy color. The core purpose of the method is cellular-level activation. Partial fasting releases internal energy, cleansing defective cells, pathogenic microflora, and activating the immune system. The body enters a new biological state, renewing and rejuvenating itself. Visceral massage plays a key role, cleansing the liver, gallbladder, and kidneys. During cleansing, stones, mucus, and dense deposits leave the organs. Kidney function restores visibly. Turpentine baths complete the process. They massage capillaries from within, restore peripheral circulation, reduce pain, swelling and pressure, and improve oxygen delivery to tissues. In 98% of patients, parasitic infestations were detected. Multiple species often coexisted in one body: roundworms, liver flukes, giardia, tapeworms. In one child, over 40 adult parasites left the body naturally, without pharmaceutical intervention. Patients are warned in advance about possible exacerbations. The kidneys react first: fever, chills, sweating, swelling, sharp lower back pain, radiating into the legs. These symptoms are not complications. They are signs of active detoxification. Ancient texts speak clearly. Cleaning the body only from the outside is not enough. A clogged intestine poisons the blood for years. In advanced cases, the body carries tens of kilograms of accumulated waste. As long as this remains, true health is impossible. The healing process begins with intestinal cleansing. Removing deep accumulations eliminates a major source of disease. But the intestine is only the first step. The next stages are blood and liver purification. During visceral therapy, herbal decoctions are used. Knotweed and horsetail are brewed according to instructions. The preventive program requires minimal time and cost. Healing is carried out in standard 19-day cycles, 14 days of preparation, and 5 days of cleansing. For 14 days, daily on an empty stomach, drink a glass of beet and carrot juice. Use small urine enemas. Hold sunflower oil in the mouth. Take local turpentine baths. Each procedure will be explained separately. After 2 weeks, a 5-day cleansing phase is added. In the morning, large volume enemas. During the day, only apples. In the evening, a warm bath, abdominal massage, olive oil with herbal support, and liver warming. At night and in the morning, cleansing enemas. Large enemas are done in the morning to remove stones and toxins released overnight from the liver and gallbladder. Without assistance, these wastes could poison the body again. Cleansing prevents reabsorption of toxic substances. Every course follows the same structure: preparation, cleansing, recovery. Every 2 weeks, a new cycle. Only consistent work, day by day and course by course, restores internal balance. Let's examine the first procedure in detail. Raw carrot juice is a natural cellular solvent. It supports the nervous system, increases resistance to infections, and works in synergy with the adrenal glands. It strengthens the eyes, throat, tonsils, sinuses, and the entire respiratory system. This juice restores energy, endurance, and helps normalize body weight and internal chemical balance. Red beet contains substances that activate cellular respiration by 200 to 300%, and in the first minutes, even higher. Beet is rich in sodium and potassium, a ratio that improves calcium solubility and prevents its accumulation in blood vessels. Its chlorine content gently cleanses the liver, kidneys, and gallbladder, and stimulates lymphatic flow. The combination of carrot and beet juice provides potassium, phosphorus, sulfur, and alkaline elements. Vitamin A in this mixture supports the formation of healthy blood cells and improves oxygen delivery to tissues. Let's move to the second procedure. Daily microenemas are performed using 100 milliliters 4 times a day, with retention for up to 45 minutes. One session can be done in the morning, the remaining ones in the evening. Once a week, a larger cleansing is applied. 2 liters of warm boiled water, with the addition of 200 milliliters of one's own urine. Research observations suggest that volatile mineral salts in urine neutralize acids and dissolve internal blockages. They help clear veins, ureters, and the abdominal cavity, purify blood and body fluids, dissolve clots, remove sand, and break down stones. Urine therapy is, above all, a powerful regulator of hormonal balance. Endocrine glands release hormones and antibodies directly into the bloodstream. These natural regulators act instantly and with exceptional precision. They function as biological catalysts and inhibitors, triggering processes that are impossible to reproduce artificially. In the human body, complex transformations occur at normal body temperature, while similar reactions in laboratories require extreme heat and energy. Modern medicine recognizes dozens of endocrine glands in the human body, yet their full potential remains far from understood. Every day, about 130 liters of blood pass through the kidneys. Only 1.5 liters become urine and are removed from the body. But not everything in urine is waste. Together with it, the body excretes its own biologically active substances. We discard what the body actually needs. When urine is reintroduced into the body, hormones and antibodies enter the intestines and then return to the bloodstream. This process helps clear the inner surface of blood vessels and restores the natural hormonal cycle. The endocrine glands reopen their connection with the blood. Antibodies begin to work again against individual diseases. Long-standing illnesses retreat, mental clarity improves, memory sharpens, and resistance to infections increases. The natural biological defense system strengthens, the need for pharmaceutical chemicals decreases, and intestinal microflora is restored. The large intestine resumes normal temperature regulation and peristalsis. Chronic constipation resolves, releasing long-accumulated deposits. The lungs activate reserve drainage mechanisms, dense mucus is expelled, and cleansing reactions may also appear in the sinuses and ears. Examples of recovery using urine therapy are numerous, including cases where modern medications failed. The effects of urine therapy can be summarized briefly. It conserves energy. It carries biological wave information. It partially replaces nutrients. It acts as a natural salt therapy. It has antibacterial and diuretic properties. It supports enzymes and hormones. It strengthens immunity. It restores tissues. It rejuvenates the body. Microenemas may be performed daily after natural bowel movement, with a retention time of 45 minutes. A 2-liter cleansing is done once a week using warm water and urine. During kidney cleansing, urine color may change dramatically within 1 day. Children may follow the same scheme, excluding fasting and oil-holding practices. In the morning, take 1 tablespoon of sunflower oil into your mouth and hold it for 20 minutes. This simple practice supports the entire body and is traditionally used to prevent and reverse early functional imbalances. Use only sunflower or corn oil, no more than 1 tablespoon. The oil is kept in the front of the mouth and gently sucked, like a candy. Do not swallow the oil. The process should feel light and relaxed, without tension, for 15 to 20 minutes. At first, the oil becomes thick. Then it turns liquid, almost like water. After that, it must be spit out. The expelled liquid should be white, like milk. If it remains yellow, the process was not completed, and the time should be extended. Afterwards, rinse your mouth thoroughly and spit the water out. This practice is done once a day, preferably in the morning on an empty stomach, but it can also be done in the evening. During oil pulling, the body activates metabolic processes, improves internal balance, and supports natural cleansing mechanisms. Once a week, a turpentine bath is used. For a full bath of 150 to 170 liters, add no more than 2 teaspoons of turpentine. The water temperature should be about 38 degrees Celsius, never higher. The bath is taken for up to 15 minutes, until a warming or burning sensation appears either throughout the body or in a specific area where there is weakness or congestion. Turpentine baths create a deep internal massage of the capillaries. They restore peripheral circulation, increase oxygen delivery to tissues, improve cellular nutrition, reduce pain, swelling, and tissue stiffness. During the bath, capillaries open, and the body feels as if it is gently burning from within. Each session may activate different areas, the legs, arms, kidneys, or joints, revealing where the body needs cleansing the most. These reactions indicate that stagnant layers are being released step by step. It is recommended to begin with local baths, as turpentine is a powerful stimulus. Only after the first full course, and only with a healthy heart, can full-body baths be introduced. Local baths have no contraindications and are even recommended for varicose veins. During flare-ups, a series of 4 baths may be used. The first 2 may raise or maintain body temperature. The following 2 help bring it down naturally. This sequence reduces fever, normalizes blood pressure, and relieves pain without medication. After each bath, the body should be dried and kept warm under a blanket. Fever itself is a protective response. If temperature rises, it means the kidneys are active. Changes in urine color and intensity reflect an increased release of metabolic waste. This is not pathology, but a sign that cleansing processes have begun. During cleansing, the body releases stones of different colors and types. From the gallbladder, 4 main varieties appear. Cholesterol stones ranging from dark green to bright yellow, white stones, and pigment stones. Large amounts of mucus and flakes are released alongside them. From the liver, deposits range in color from deep brown to a milky coffee shade. Stones from the pancreas are different. They are dense and vivid, ruby red, beet dark, or orange. Unlike gallstones, pancreatic stones do not dissolve. They only darken slightly while keeping their shape. This means that without proper cleansing, they remain inside the pancreas unchanged. After completing a step-by-step body cleansing, it is safe to return to physical activity: running, cold exposure, gymnastics, movement. Do not fear complications. What remains of the old body is only the name and genetic blueprint. This system restores natural balance, internal clarity, health, physical beauty, and a clear, calm mind. Trust the body's natural ability to heal. Respect your body. Let go of excess, inertia, and the cycle of chronic illness. Visceral abdominal massage. According to international data, In 40 out of 100 cases, the cause of so-called cardiac death is an over-distended intestine. When the intestines swell, the diaphragm is pushed upward, compressing the pericardium and disrupting the heart's function. In some cases, intestinal bloating also impairs lung breathing. Even in people who appear perfectly healthy, professional athletes, yoga practitioners, vegetarians, and raw food followers, painful zones are often found in the abdomen. Most people consider this normal and ignore it. But true health means no pain when pressing on the abdomen. When a person understands this and begins to work consciously with the belly, visceral compression techniques bring profound healing to the entire body. The gallbladder plays a central role. It is considered the key organ, and without restoring its function, systemic recovery remains incomplete. Stress almost always affects the gallbladder. This may appear as heaviness or pain in the right upper abdomen, or as tenderness when pressed. Such reactions are linked to venous congestion and bile duct spasms, leading to bile stagnation, inflammation, and infection. In most cases, impaired bile flow is accompanied by constipation or digestive disturbances. With correct stimulation, pain sensitivity decreases daily. Visceral massage of internal organs is a core element of this therapy. On our website, you can access the full visceral therapy method in text form and enroll in the video course on traditional Slavic abdominal massage. The link is available below the video. Health is not restored by fighting symptoms. It returns when the body is allowed to do what it was designed to do. The organism always seeks balance, cleansing, and renewal. When you stop interfering, it remembers how to heal itself. Systemic visceral therapy does not treat organs separately. It restores the human being as a whole. Listen to your body. It knows the way back to health.